Ketamine's always been used in anesthesia as an anesthetic.
It works on many of the receptors, or they call neurotransmitters. These are things that communicate within the brain. When people have chronic pain, they also have chronic changes that occur within the brain as well. What they discovered on accident is that when you use it at a very low dose, it can take immature cells or cells that have not communicated and re-establish communication. And by allowing them to reconnect, re-hold hands, and establish new connections that didn't exist before, you actually treat the depression.
So it's almost like hitting reset on the brain. Ketamine is used to treat behavioral health and chronic pain. Patients who are suffering from treatment-resistant depression, major depressive disorder, anxiety, PTSD, it works amazing for usually 6 treatments over 2 weeks, around every other day per treatment. Most patients will feel relief relatively pretty quickly, but it is kind of short-lived. That's why we have to see our patients usually every 3 to 4 weeks post for a booster. So it would be a single infusion after they did their series. Our success rate is pretty high here. It's upwards towards 84%. Changes like that affect you in such a way that you kind of just want to share it with everyone.
We took thousands of patients and we looked at the outcomes, and we found that using a certain dose, the patients improved in 3.5 days.
We're a data-driven facility, meaning that we're not just giving ketamine based off of a weight. We're giving ketamine based off of how the patient's doing and supporting it by the data that we've collected. Also, kind of knowing exactly how much ketamine's in the system using labs. We take all that data, and as we're collecting it, we're constantly aggregating it to see how the patient's doing. And when we wanted to be able to provide data that supported that the patient was getting better, and be able to provide that data right back to their psychiatrist so that they can kind of see how their patient's doing, track that outcome, and then also hopefully make some adjustments on their meds too. One of the misconceptions is that ketamine is actually not covered by insurance. Our first goal when we started creating an infusion center was to figure out the insurance piece that allows us to utilize some of those insurance plans so that the patient can actually utilize their benefits that they pay for. Ketamine has changed my life, and I get to get up every single day and I get to see people get better. And in medicine, that's not always the case.